To the hospital for care will cost you more in the next year.
Hospital leaders say costs are up across the board and say more needs to be done on the state level to address affordability. As Vermont's demographics shift, UVM health officials say patient care costs are changing too. On Friday, Vermont's largest health network announced their priorities and budget changes going into the next fiscal year.
Healthcare costs are going up. We're paying our staff more, equipment's more, pharmaceuticals that we're using for patients are costing more. But even in that environment, we're being as cost efficient as we can and providing the best possible care that we can at all of our sites.
All three of the network's major hospitals are seeking budget increases. UVM Medical Center is requesting a nearly 8% increase. Central Vermont Medical Center is asking for a 6.5% increase, and Porter Hospital is asking for just shy of 3% more.
Because our state is not growing fast enough to kind of keep pace with the aging population that we have. That's where the burden is falling, is on the smaller and smaller group of commercial insured.
The hospital says it's already cut $20 million in administrative positions over the last year, and without a bigger budget this year, cuts to services might be on the table.
Then that might actually cause us to take a look at the volume of services that we're providing and make some decisions on cuts that we'd have to make.
And while the hospital projects a 9% increase in revenue next year from more patient visits, expenses will rise as well. The hospital says it needs the budget bump to cover costs for things like new equipment, a bigger neonatal intensive care unit, and a new outpatient surgery center. But all of this means more money out of pocket for patients.
We firmly believe there's things that we can do as a state, all parts of the state together, the health system, the legislature, our regulators, to bring down commercial premiums. We have to work on it together.
Now, the network says they're focused on improving access to care and growing their workforce. The Green Mountain Care Board still needs to approve the requests by the network. A final approved budget is expected by October 1st.